Hi, this is Val from Tanzania. This video shows the trip that was taken in June-July of this year, 2011. The video shows the first part is the mobile clinic in Boko. The second part, I believe, is the students, and then the orphanage. The orphanage shows the well, the children, the kitchen, the beds, and it gives you an overall view of what the orphanage is like. Before we started at the orphanage, the children were sleeping on cement floor with two ripped grass mats, and now they have dishes and they have beds, and we've built toilets and showers for them. We've dug a well, and we are moving forward with the kitchen. The next thing will be biogas so that they won't burn wood to cook food. The next part after that, there was HKMU students, and they are most grateful for our support, because if we couldn't support them, then they would not be in medical school. The outcome of the support is huge support for the Tanzanians who cannot get to doctors now because there are so few. And then the last part, I believe, is the last mobile clinic, the one in Mikacheni village, which is inside the larger city, but the people have absolutely no money and can't get out of the area. The mobile clinics do HIV/AIDS testing. They do PAP testing for STDs and cancer. They do pre- and postnatal care, they do general care, and they treat not only women and children, but whoever shows up. The care is free. Thank you for watching. This is the clinic in Boko. The original tree that was here fell down, and now the clinic is under another tree, but the fear is this tree will also come down because it's very, very old. Right here, what they're doing is they're weighing the baby to make sure the baby is gaining weight and is healthy. And they have the weighing thing, the scale is hung on a branch of the tree. So this is the nurse doing what she needs to do. And then over here, there's a table that has vitamins, iron for the women, HIV testing things if they request. They also need a place here where women can be examined, and before they were doing it under the shade of the tree in a van, but it is not working well. So we need to seriously consider building some sort of a shelter here. Today is a very cool day. It's about 32 degrees and in the shade, and so nobody is too bothered by what's going on here, but having to sit in the sun is not a good thing. Another child being weighed. They go through the weighing first, and then they do the rest of the treatment for the women and children and the men and boys who come. This is the same tree. It is actually covered in a parasite, and it's just a matter of time to decide that it's going to fall down. Okay, over there was the other clinic. In between those two buildings is the stump of the tree that fell down, and they just fall down. This is the area that the people are being looked after. You can see the houses, and this is the clinic car that comes out. And here's another house, and
it's like the gods.
People eating their lunch and going with the children to the clinic. Yes, so they're on their way to the clinic from somewhere else. Okay, so this part over here, they tried to plant banana, but there's not enough water to support them, and most of them have died. If you just look at the ground here, it's very, very dry.
Over on the other side there, this is, they're trying to grow here, and that's not working very well either. So there was a study done that Health Reach did this, helped to provide the funding to do a study, and the well will need to be quite deep. So that's a discussion that will go on, and hopefully we'll be able to get something going here to be able to plant here, because that would be a great help to the hospital in feeding the people there. This bare area here was filled with cashew nut trees, orange trees, mango trees, and because of climate change and the lack of rain, it can't really support much of anything. They tried to plant moringa here, which is a medicinal plant. Actually, it's a tree, and the leaves are like green. Well, it is green food, but it's got all the complete amino acids, so it would be very good for the people. But it can't be supported here because there's still no water. This is a dry stream bed that used to feed some of the stuff around here, but it's no longer available. It's no longer viable. We are at the orphanage. This is Nira Orphanage in Mbagala, Tanzania, and this lady that you're looking at is Edith, and she's the lady who runs the orphanage. We're walking here. Up here we see there's a water tank, and that's new, and then now we're going to walk over here and look at the whole orphanage. This is the beginning here of the kitchen that we're beginning to build with Health Reach, and this, we're going to come into the back here, and this is the center of the orphanage, and I don't know, here you can see the children are sitting. They're going to have lunch. There's Edith and Emmy from the hospital. The first door is the office, and this is the center court area. We're just going to come over here to the office. And so Edith will take us into the office now. This is a cool day. It's summer here, and it's probably about 30 degrees or 32 degrees. This is the office, and this is one of the helpers in the office. Before, when we were here, there was no office and only burned out rooms. So this is the office, and this is Emmy in front of us, Nurse Emmy from the hospital, from Nishimikachani. And here's Edith at her desk, and she's got records for every child. So this is a legal orphanage that has all the documentation that's needed. She has a bookcase here and some shelves to put things on. And right now we're going to go, these are the children just through the fence here, and they're playing blocks and doing some schoolwork and doing more schoolwork over there. Jumbo. This is the dormitory for the girls, I believe, no, this is the girls' dormitory. These are the beds that Health Reach provided. There are 2, 4, 6, 8, room for 10 to sleep here, and the same thing in the other rooms. The nets, very, very, very simple, but way more than they had before. Before they were sleeping outside on a grass mat that was ripped. So I think that hopefully there's some more self-esteem here. We're going to just go back out here. The children are sitting outside. This is the center area again. And we're going to go to the next dormitory. Then we're going to go to the new toilet area that's just being built, and then we'll go. This is the second dormitory area, same as the other one. And you can see here It should have been Health Reach Canada, but at least they have something. This is the well. It's dug down quite deep, and there's a pump that pumps the water for the showers, for the toilets, for the cooking, everything there. And now this is in the center area, and then over here there's a tank on top. The structure was built to house the tank so that the water could be high and run down. And over here, this area that you see with the cement blocks is the kitchen area, and it is just starting to be built. There'll be kitchen area here where Edith is standing, and on the other side over here is the store area. It'll be for storing the food, the rice, the beans, all of that sort of thing. Here we are, somebody from the orphanage, a boy. He's coming over here, I think for lunchtime. This is the current cooking area, and what's used is wood. It makes terrible smoke, ruins the children's lungs, causes stomach cancer. It's not very good. These are the pails for cooking, and this is how the food is currently cooked in a fire, and that's a pot over there. So this is what we're going to rectify next. The chickens are here too, and hopefully they can be caged off soon. Now there's vegetables that grow on these trees. There's an issue because the chickens come and eat the vegetables that they want to grow here. So there's not that much that's growing now. Hopefully they'll be able to fence it off and continue to grow some food. The children are having lunch now, and we're having mchicha and ugali. Yeah? Mchicha, ugali? Ah, okay. And they're enjoying their food, and they have water to drink, and everybody's having a good meal today. It's not over yet. I think there are more children, but maybe they're at school right now. There are more children. They're bringing their chairs, and they're going to sit here. Good sized portion here. That's great. Jumbo. Mchicha and ugali. Yeah? Okay. Somebody else. Not holding back with the portions here. Holy cow. This is the Mikacheni Village Clinic, and now there's a baby that's being weighed. This is the nurse, and this is another client waiting to be seen. And there's another lady back at the back here with another baby. And this is Emmy. Right here, the head nurse. And this is the form that comes back with every patient. There's a form that they look at that's kept, the record that follows the child's progress. This the little boy getting out of this. He's going to go back. Lots of them cry, but he didn't. There's a container here. It has all sorts of things to test for HIV, to give vitamins to pregnant women, to test for other things. They also do pap testing here if it's needed. There's a room in the back. We're at the end of the day, we're very late here. We've been stuck in traffic all day, which is something that happens here. Here we are, we're weighing another little baby, just a couple of months old, or maybe even a few weeks. Here's the mom. They hang him on a scale in a little thing. There's the man that's getting some help too. Here we are. She's filling in the form to monitor the baby's progress. Yeah, this is the village where this clinic is serving. It is very narrow streets. And a lot of people. Okay, let's go. 'Cause 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 'cause
This is
Prudence.
Premier, who is a final year, 5th year student at Hubert Kairuki Memorial University. He's getting ready to graduate, and we're just going to spend a couple of minutes talking with him because we've helped to support him to stay in school, and there are 2 other people we're going to talk to here as well. So Prudence, how was this for you?
First of all, from the part of sponsorship, it was helpful, and comparing the 2 times before the sponsorship and these couple of years you have been together with your assistance, or the support we have been receiving from you, it has a great impact and relief from the struggle we had before. And for the part of study, because it has also impact on giving us a time to study and not being stressed with how we can raise funds and all that. And we are sure that from the saying that you told me the last time, that you will be a doctor, I'm sure that that saying is going to reveal now soon.
Yes, yeah. Well, we're all watching to see how well you do.
Wow, I hope so.
Yeah.
Thank you very much.
I thank you. And we're going to move down to Fredson, who is in 3rd year. So Fredson, what can you tell us?
In the first hand, we are privileged to have you here.
Thank you. Thank you.
Thank you. I personally thank you for your support. I acknowledge your assistance. About here, HKU, the most fascinating things about HKU is high quality teaching and research, and the diversity among its students and staffs.
So do you want to be a researcher? Is that where you're looking to do?
We do researches, and I personally have proposals which I'm still progressing, and at times I will have to do research.
Okay.
Yeah. We anticipate that after 5 years, we will be really prepared to go and share and save not only Africans, but also the world entire.
Yeah, I hope you're going to also support the Tanzanian people because they need you.
Yeah.
Is that a goal as well?
Yeah. I personally am passionate. I am passionate about the future and about the community around me. We are not trained for jobs. We are trained to think, to broaden horizons, to create, and to inspire the people around us.
Thank you.
Yeah.
Thank you. Thank you very much.
Thank you.
I thank you for coming. And this is Margaret.
Yes, I'm Margaret Masala. First and foremost, I'd like to thank God who has been with me towards the whole 5 years journey. And I thank God for having you to support me. And it was a very, very big support in my side. And in my education here, the life was difficult and the journey was so rough. As you know, medicine is very demanding. I thank God I've passed through all those and I've made my good grades, and hopefully I'm ready to serve the society around me, around Tanzania and the world at large. Thank you, and may God bless you so much.
Well, Health Reach is glad to be able to help you, and we are looking to watch you
Okay.
out there when you're doing good things to help the people. Thank you.